So, hello, good evening, everyone. So, today we are going to have Joseph Wong with us. And Joseph just passed his FRCS Section 2 exam in November 25. And he's currently working as a locum consultant in Leeds Teaching Hospital. And it's a great pleasure for us to have Joseph. Joseph, many congratulations. And I'll be very happy if you can share your journey and quickly introduce yourself about when did you appear for the exams and what was your strategy. So the candidates who are appearing in the upcoming exams in May 26, they definitely will benefit from whatever suggestions you have for them.
Yeah, thank you, Ankit, for your kind introduction. So I'm Joseph. I was from Hong Kong, but now I work in Leeds. So um, I hope I can share some of my strategy and as well as Ankit's advices as well. So to give you some idea, I passed my session 1 in January this year, and then I took the session 2 in November, and luckily with the help of Ankit as well, so I managed to make it. So yeah, so
So
yeah, I
go
mm,
back to your section 1 days. So you appeared in January. So what resources did you use and what was your plan for the section 1?
so I I had the two books. So I think that two books that I used to study. That's one urology MCQ, and then that's the second one urology 1000. So basically, I use those two books and then try to finish as many as actually I finished all of them. So just
So
yeah.
what do you think are the questions standard like? So is it very difficult, or if somebody is reading the standard textbook, is it possible for them, or do they have to go beyond the textbooks?
Yeah, I think the exam question is quite similar to the books, and actually the two books that I use, actually some of the questions they came up from there. So, but I think to me is quite difficult. So actually, I just pass it. So I wasn't having very high marks, but I think as long as you pass it, so
I think getting a pass mark is itself a very big deal in the section 1, and some
yeah.
can even believe that section 1 is more difficult than section 2. Do you also believe that?
I think to some sense, yes, because there are a lot of basic urology principles, or even molecular or microbiology,
Mm.
or those topics that you are not is not clinical, and you are not in touch with at your work. So
I have
it's
read them a long while back, so you are not in touch with them. So it's a lot of theoretical than exactly clinical. So it's difficult to recall them, and unless and until you have read it recently, you won't be able to answer them.
No, I would say especially the renal transplant part, because in my exam, in my paper, there were quite a few of them on immunosuppression and rejection, and management of the rejection for renal transplant. So
Right.
which I wasn't familiar with. I don't think urologists are normally familiar with these immunosuppressants, which are
Right.
managed by.
Yeah, so what I have even I've received this feedback from the candidates that sometimes they ask a lot of question on transplant, sometimes they ask a lot of question on urodynamics. So at one
Mm,
particular exam session, they are pulling a lot of questions from one particular area. So here,
mm,
I know this transplant, even if they're asking questions on transplant, what I've tried to focus over the last few months is they are still asking questions which are clinical and
mm,
drug related to like immunosuppressant drugs, their mechanisms, their side effects. So the questions are very clinical. So what I would
mm,
recommend is if you are reading transplant, going to go don't no need to go into too much of immunology. Just read the basic of the drugs and read the
mm.
complications and the complications of the transplant. This is something that I think most commonly you're expecting in your theory exams.
Right. Yeah, I think so.
Yeah. So can you just say the authors of the books again that you prepared? So I think most of the candidates will really want to know the name of the books that you studied because you said many questions were from that book also.
Yeah. So would you mind if so this is edited, right? So I need time to find out the
It's
name of the
fine. I
book.
think it has been almost an year you studied that. Did you use your section 1 books for your section 2 preparation?
No.
So what was your plan? So did you make any notes for the section one?
Actually, no. I just do the two books. So one is so one is the urology MCQ, the one with two kidneys in the front page. Is it possible if I can go and have a look?
I think it's Manitaria. I think the author of the book is Manitaria.
Yeah, the one blue and green
Got it.
for the front page.
Yeah, it must be Manitaria
Yeah, and then the other is
or the Rafiq Anjum.
also yeah.
Got it. Right. So these are the common MCQs that everybody is doing it. And sometimes you might be lucky to get questions, but the topics are usually the common ones.
Yeah.
So you did not make any note for section one. Then you started all from the beginning for the section two. What was your plan? When did you start for the section two preparation for your November exam?
So I think the earlier the better, but I started in about 3 months before the exam. So I started in end of July, beginning of August. I mean,
Okay.
you can always start earlier. So yeah.
So
So
yeah.
mm.
So how did you plan your preparation when you started it in June, July? What was your plan? Did you have any study partner? How did you manage to start all of it, like the whole preparation all over again?
Yeah, so I think it's important to get your own study group. You may not like practice with them started from the beginning, but it's good to have buddies to cover your blind spot. And so I mainly study the revision FRCS revision notes, as well as some notes from some of the registrar who took the exam before me.
Right.
So yeah, so basically the notes is a combined of the FRCS revision looks as well as the BIOS revision course. So there's
Right.
someone before me who make the notes for that, and then which I find it very useful.
Yeah, I think every candidate has a set of notes, and it is already it becomes easy for the future candidates when they go through the notes. Half of the thing is already done. So reading notes
Mm,
is beneficial, but at the same time, the communication stations is more about expressing your knowledge. So if you
mm,
have the knowledge compiled, things become easy, and all you have to do is express those knowledge in a very simple language and with standard references. So, what did you do for the communication practice? How did you manage the communication aspect?
So I think first of all, as I said, the study group you practice with your buddy, and also because I also participated in Ankit's. I didn't participate in your group Fiverr practice course, but I did join your one-to-one tuition and also the mock Fiverr, which I find it very useful because I think ultimately the actually what I find in the exam the scenarios are quite complex. So it's not it's not very straightforward. So usually come with different complicated or comorbidities. So which will affect your management strategy. So I think it's important to expose to as many scenario, especially those more complicated or more complex scenarios, which I find it very important. And also you practice, keep practicing with your friends as well.
Right. So even I agree this that you don't prepare yourself only for the simple scenarios. Don't expect that you'll be
Mm,
asked on management of avoiding LUTs or the storage LUTs.
mm,
It's not so simple. The exam is not so simple. So I
mm,
know I remember in the mock exams when we are doing we discussed the more complex situations and we were trying to push as much complexity as
mm,
we can in a LUT scenario. I think we had a
mm,
scenario of Parkinson with lower urinary tract symptoms, with a sexually active gentleman, and with a high
mm,
PV. So we try to make things very complex, and it's very
mm,
important that you train yourself with such complexity and
mm,
try to frame your answers. And once you know how to deal with the complex situation, everybody knows how to manage patients. So it's not about managing patients, it's about rationally answering those steps. So exam is
mm,
all about that. The examiner knows that you are a consultant, you are managing patients, and you are absolutely doing justice to your patients. But what happens is that there is a time limit, and you need to express yourself in very scientific terms in a very short
mm,
sentences, and in a very rational way. You cannot go back and answer, okay, I forgot to mention about the PVR and something like that. So this is what I think the practice is important for. And when we had the mock, I think we had this all discussion and we tried to bring complex situations as well. But sometimes what
Mm,
happens is when we discuss a lot of new questions, candidates start losing their confidence. So I always say that whenever you practice for the mock, there are a lot of mock sessions available. Don't lose confidence and keep thinking that you are learning something, and you it's better that you make mistakes in the practice sessions. So how
mm.
frequently you had the practice sessions with your group? Was it like every day or twice in a week? How frequently was it?
Yeah, so I think the closer towards the exam, the more frequent. So we started as once in a week, and then but 2 months before the exam, we start like twice a week, and then the month before the exam, the month of the exam, we do it every day.
Right.
So yeah.
I think it's very important that you have discussion with your colleagues, because you change role. You become a candidate at one time and you become an examiner at one time. So it also gives you a perspective of the examiner. And being an examiner is also important because you know what questions you might be asked once you face the situation of an examiner. Once you're an observer in the group, that's also important. You observe, you understand, okay, this is the mistake which somebody is making and I should learn from it. So group study,
Mm,
I always encourage whoever is always asking me. I always tell them that group study is one of the most important thing for your section 2 exam. What other
mm.
things would you like to advise? Because many students, they want to know whether it's important to remember all the guidelines, and is it necessary to code the trials in the communication? Did you code the trials a lot in your communication?
I try to quote as much as possible that I could recall. I would say that there's some trials or some study, especially the oncology station or functional station, that you absolutely need to remember. But this will come in with your practice, and yeah. So yeah.
Yeah, so I think, do you feel really that examiners directly ask for the trials, or it's like if your communication is going smoothly, you may just go ahead without without even quoting the trials?
So I think there's some stations where they ask specifically for the trial, like the prostate and the bladder. But I think these are quite important as well. And also in the BPH, the missed, the examiner will ask you about the trial, but not necessarily the values, but the name, at least the name of the trials. Yeah.
Right, right. So, what I always recommend is whenever you're reading the BPH and the CA prostate,
Mm,
these areas you need to know the trials, and
mm.
when you know the trials, at least know a little bit of the conclusion of that study, because
Abs-
knowing the names can be tricky sometimes, and you may if you don't say the next part of the trial, then it's better to it's better a trap than saying something that you don't know.
mm,
So don't say it
mm,
if you don't know anything. So.
mm.
Uh, so this goes about the what about the EAU guidelines or the NICE guidelines? There is always a controversy which guidelines to read. So which one did you follow and how did you manage the guidelines?
So I think because we this is a UK exam, so I follow NICE guidelines as much as possible. But I also bear in mind with the EU guidelines, especially there's any discrepancy, and sometimes the NICE guideline can be quite not outdated. And in that case, I may use the EU guideline for the newer, especially the oncology stations. Yeah.
Absolutely, absolutely. I agree that oncology is best from the EU guidelines and
Mm.
have a concept in oncology because they can dive deep into the oncology. What did you feel? Do they ask a lot on the history nowadays, or they bother more about the management and the complications, and they take you to the high level of Viva rather than just starting from the very basics? What was your experience this time?
Yeah, I think they basically not based on the guidelines, but they talk about the clinical scenario and the management. Um, like,
So
but
they
you
have
can always, yeah.
management, or do they start straight from the like the common practice is asking for history, examination, investigations? So do they start from straight from investigations mostly nowadays?
Um, um, yeah, but I have the feeling that the examiner want to quickly move on from the history. So I think only a few stations started with history, and
Right.
then but most of they might start with how do you evaluate the patient, but they quickly move on to the history. I mean, the physical examination, even the investigations.
Absolutely. So even I would recommend that we have a tendency to have template answers. So
Mm,
don't prepare any template. So just like
mm,
Joseph said, the examiners have a tendency to move to the investigations and the management very quickly. So even if you have
mm,
template answers for the history examination, not going to work always. You should
mm,
be thinking broad and you should be ready to move to the investigations and the management and dive depth into the
mm.
complications and the follow-up, and that is more the area of concern for the examiners where they can score you.
Yeah, exactly.
Right. So, Joseph, did you face any station in your exam which you did not know anything, like just absolutely new?
Uh, Fortunately, I think that there are a few unexpected station. However, I think I've encountered them before. Some of them did appear in your video and the mock fiver that I experienced. So luckily, I I experienced them before the exam. So not
Right.
so much
I
surprising.
honestly, this time I got candidates. They came back and say thanks for the mock viva. There were some scenarios exactly from the mock viva. I don't know. This was just a coincidence, and
Mm,
I think it feels good when things become more predictable and you don't get
mm.
surprises in the exam. So you, if according to you, did not get major surprises.
Yeah, I think I haven't got. Yeah, some of my colleagues did have a few, but I think, yeah, that's why I find your notes are very very useful, and they're really exam scenarios, and they did those complicated or complex scenarios did come out.
Right. Even it feels good that when we can have as much of discussion before the exam.
Mm,
That's our whole
yeah,
aim for the classes, so that we can make you familiar because the exam requires a lot of mental stress. There is
mm,
already a lot of investment in the exam. So
mm,
again, so there are some students who are not able to make it, unfortunately, but it feels very bad when you have done your best, still just by a few marks you cannot make it. So the
mm,
whole classes are designed in such a way that those candidates can make best use of it, and just you don't
mm,
lag behind by 1 or 2 marks. That is very painful because you have to again go through all over this journey, and it becomes very stressful. So I hope I hope everybody who is attending the course, who is joining the classes, they find it
mm,
useful and they can make the best use of it. That is what our
mm.
purpose is. So
Yeah, I also Yeah, and also funny because the marking scheme is that even you think you have done not so good in one station, then you might compensate it with other stations. So, and also, in fact, the station I thought I did the best didn't come out to be the best station, but those that you thought you might have done very poorly, it might turn out not as good as, I mean, not as bad as you expected.
yeah, so
So,
I definitely want to hear more about this. This is something which I am getting feedback this time also, that
mm,
they have done the best. Okay.
mm,
Somebody, suppose you have done your best in one particular station, like a pediatric or an oncology, but you don't get
mm,
the expected score. What do you think? What
mm.
could be the reason for this? Many candidates are complaining like this. What do you think should be the reason?
So I don't know whether like that. Obviously, many factors. So you thought you have done good or done very well, but actually you might not. You might be overconfident in that station, and also sometimes the examiner just are more strict, so they just gave you less lenient marks. So, but you might have other examiner in other station that might be more lenient. They are more generous to give marks. You never know. So
Right.
I saw some of the candidate. They for example, usually in the beginning, the first station, uh, the candidate or I tend to be more nervous. You tend to not start as good as you expect, but try to stay composed and forget about the station you had just had and concentrate on the next station. I think that's very important. And yeah, I mean, yeah. So that's my
Right.
advice. Yeah.
That's very important. That sometimes what happens is confidence matters, right?
Mm.
So
Yeah.
sometimes the examiners, if you are not confident, if you know the thing, you are saying the right thing, but if not confident, the examiner might mark you on that, less you on the
Yeah.
confidence is a very important factor for the
Mm,
Viva exams. So
mm,
nervousness is always there, but don't let it affect you in such an extent that you start becoming affecting your Viva and your voice starts
mm,
trembling. So this is all, I know these are all natural feelings to have this in the Viva, but all you have to do is suppress them and don't let it affect more than one station. So
mm,
once your first station goes better than what
mm,
you actually are nervous with. So if your first station goes well, then I think it's easy and you start getting confidence and you become less nervous subsequently. But especially
mm,
this is for candidates whose first station is not as expected, then they have to
mm.
be extra careful in the subsequent stations not to become more nervous.
Yeah, exactly. Yeah.
So do you think technology is going to be replaced with some other stations subsequently in future?
You mean the
That technology scenarios are going to be replaced with something because there is an update probably that some other sections are coming up. So are you aware of any amendments in the section 2 format?
I think luckily I think my image and technology station are those still those conventional ones. So but I think it's always the most like that there can be many innovation that are coming up, and so I think that definitely there's an expanding
Right.
scenarios. Yeah.
Right. So even the technology stations might be actually replaced with something which there might be some amendments in the exam format, and
Right.
probably the gender assignment surgeries could be a part of the exam. So
Right.
this could be more challenging, but definitely, if there is an amendment, we have to prepare for that amendment in advance. So,
Yeah.
what is your advice for the candidates who are appearing in May? They have around 6 months starting from today. What would you tell them?
Mm. I would say start as early as possible, get your study group. And I think the study group, the number is also quite important. So try to get, I think, three, perhaps the best, most four. So two are too few, and five are too many. So the number is also important. So start early, try to keep practicing, and also try to get some of the consultants in your working hospital to try to ask you scenarios from time to time. And I think the Ankit's video also helped me a lot. And yeah.
So I'm very thankful for you for the honest feedback, whatever you have, and I'm sure that candidates who are listening to you will definitely follow whatever you have suggested. Starting early, I definitely agree. They should start as early as possible. So if you're appearing for the section 1 in January, I'm
Mm,
sure your target should be for the section 2 in May. It's better that you
mm,
within the 5 months gap rather than waiting for 1 year because you
mm,
can wait if the situations don't permit or you have some other commitments. But when you have committed for the exam, make sure you actually devote your time to this because
mm,
this requires at least 3 months of commitment. And if you're
mm.
starting early, it just gives you an extra time to revise more things and get updated with more recent advances.
Yeah, absolutely.
So, Joseph, thank you so much for your advice and many congratulations once again. And I'm
Oh,
sure
thank you, Linkit, for your mock five, your advices and the feedback for my
you, you
fivers.
you made it through because of your hard work. You have been doing it for almost 3 to 4 months, and
Mm,
if the courses probably helps in giving some direction, but actual success depends on your performance. And
mm,
just because you had the mock and you had all the things
mm,
settled in your mind, so you were able to articulate things very easily, and
mm.
you did a lot of practice, so you got the results of your hard work. I think that's what you actually deserved, and
Oh,
wish you all the best, Joseph, and
yeah,
um,
thank you very much, and much appreciated. Yeah.
stay connected. And I'm sure that if we get some questions for you from the candidates, we'll connect them to you.
Mm, sure, no problems.
For your time. Thank you so much.
No worries.